Welcome to the Inner Practice. I'm your host, Jackie Vandertoon. Today, I'm excited to talk with Dr. Jill Bailey. Jill began her career as a family doctor in a small community, walking alongside patients through births, diagnoses, losses, and ordinary Tuesdays that quietly mattered. For 14 years, she practiced medicine, learning that healing rarely fits inside a prescription pad or a 10-minute appointment. Over time, she felt called deeper into the emotional terrain beneath illness. She shifted her work toward mental health and addictions, drawn to the spaces where suffering is complex and recovery is rarely linear. As a general practitioner, psychotherapist, addiction physician, and mindfulness group facilitator, she believes in seeing the person before the problem, the humanity before the history. Jill is on a journey of healing others. She created a psychotherapy program for individuals living with cancer. She facilitates mindfulness groups. She contributes to research exploring intimate partner violence experiences among Canadian physicians. She teaches at a new medical school, helping shape doctors who will one day care for all of us. She is impacting the lives of many in quiet ways. At home in Orangeville, Ontario, she is raising 4 boys and imagining something new for her community. A women's health clinic designed to be unhurried, welcoming, and grounded in evidence and compassion. Today we explore the life of a busy physician, psychotherapist, researcher, mindfulness teacher, and the presence beneath the titles. This is the Inner Practice. Jill, I am exhausted by reading everything that you're doing.
Somehow on paper, it sounds different than to live it.
Thank you so much for taking part in this podcast today. I'm really excited to have you here. So Jill, take me back to when you first were like, hey, I want to be a physician. What was it that started that process, that thinking process that carried you forward to become who you are today?
Yeah, so when I reflect on that, I definitely remember my sort of story for years has always been, I always knew I wanted to be a doctor since I was 12 years old, but I don't really have like a moment that I remember making that decision or, a certain experience. I know some of my colleagues, went through, a childhood illness or saw a family member ill and thought, okay, I want to do something like that. I want to help people. I just feel like I always knew, and I know that sounds really cheesy. Mm-hmm. And even as I went through different levels of, high school and then university, I had a few friends who also were very interested in medicine, and then for a variety of reasons, they changed their path. And I feel like I was just always laser focused and never changed my mind. So it was something about enjoying science and enjoying people that it just seemed like there was no other option.
What would you say is your favorite part about being a physician?
When I did family medicine, what I really loved was seeing the families and seeing the resemblance between family members, even sometimes making the connections of, oh, so you're so-and-so's aunt, or that's the older sibling of that person, and kind of noticing the familiar kind of facial features or just mannerisms, and just hearing about people's lives, listening as they would explain their symptoms or what was happening, and just getting to hear a bit about like how they make their coffee in the morning or what they were doing on the weekend, and just getting that little window into seemingly mundane things that people would share. And then of course the really big things that people would feel comfortable sharing, that it never ceases to surprise me how just having that title and having that role really allows people to open up and say things that they would never just say to anybody else. So it's really a privilege.
I was just going to say that's kind of a privilege, in having someone basically open their door and say, hi, here I am. I'm going to reveal potentially the most intimate parts of my life that no one else knows. That's I assume quite a gift. But from what I'm hearing from you is you're a very heart-based physician in looking at people and hearing their stories. Can you comment a little bit on that?
Yeah, thank you for saying that. I consider that definitely to be a compliment. Although it makes me think that some of the more old school thinking might think, oh, leave your heart behind at home and just use your brain. Right. But I really do think that the older I get and the more experience I've had, I think leaning in more to the art of medicine rather than the science is really the best thing for me, for my being burnout resilient and just enjoying my job. rather than focusing more on the brain and the cognitive piece, or the just making the diagnosis or coming up with a great treatment plan. Of course, all those things are really important. But I think especially my time working in addiction medicine has helped with that, because often my whole afternoon is available to meet one new patient. Right. And we ask them a lot of questions. We talk a lot about their childhood history and their addiction history. Sometimes they've had a lot of things happen to them that they've gone through in their life. And there's just a lot of time and space to just have whatever conversation is needed. And really trying to be trauma informed and sensitive to, not demanding too much of them, but also giving them the time and space, because sometimes people do just want to talk. And I always find that first interaction, again, especially in the addiction situation, is such a beautiful time to just be able to let someone tell me their story if they choose to, if they feel comfortable, and not to have that time constraint of, we only got 10 minutes, so better hurry it up. But we can really just spend that time together. So it's really been a gift working in that setting to be able to have those extra time with people.
I think it's kind of fascinating how, maybe you can just share, you've kind of taken a little bit of a trajectory from having a family practice to moving into addictions to doing research to teaching. I get exhausted saying all of it. Where did that switch come from? Like, where did you go from having I'm going to make the assumption, the 10-minute mundane Tuesdays to move into more of that addictions component?
Yeah, so I think starting off my practice, I really had the sense that, I wanted to work in a small community. I liked doing a variety of things. I was placed in Orangeville as part of my residency program at U of T, and I really just felt kind of guided into this place. And then I also realized, only in retrospect, that I had this idea that good family doctors stick it out and have the same practice, quote unquote, forever until they retire. As I was saying, I do love seeing families and seeing kids grow up, but the idea was you would do that for like 30 to 40 years. Otherwise, you weren't being a good family doctor. Right. And I think I really had to let go of that narrative that, there's one way to do it, otherwise you're doing it wrong. And actually, as I'm saying that now, I think I'd probably apply that to lots of other things in my life. There's only one right way to do it. But when I realized that, I could use my skills in different ways, and there actually was no law that said good family doctors have to stay with the same practice for 30 years, even though I realized I had created that sort of rule for myself, it really gave me the freedom to say, well, what else would I like to do? And to allow myself to do something that I would really enjoy. And it wasn't that I didn't enjoy family medicine. I think it had its season for me. And I was actually during the COVID pandemic that I started doing more psychotherapy. There opportunities came up to do a fellowship in psychotherapy, partly because of all the virtual care that we were able to do, as people were trying to stay home and not come into clinics unnecessarily. And I really noticed just how having that extra time with people just felt so good, and I saw so much change in the patients I was seeing in that setting, that in my, again, as we're saying, 10-minute appointments, to say, hey, you'll feel better if you exercise more, or maybe you should drink less, or all these things that just saying it does not magically make it so. Right. And individuals have a lot of complexities to their lives, and really like being able to accompany people to be able to make the changes in their lives and empower them to do that by just talking about it for more than just a couple of minutes, and sort of that finger wagging, hey, this is the guideline for how much exercise you should get, somehow also doesn't magically motivate people. They really need to unpack more, like, how can I really fit this into my life, and what might get in the way, and my favorite question, how can I make it easier to do? And so that I really found rewarding. To really sort of offer the therapy rather than to simply provide the diagnosis and suggest the therapy. Although having said that, I have a colleague that I worked with at Homewood in Addictions who, during my interview actually, she said every interaction we have with the patient is therapeutic. So even if we're not quote unquote providing therapy, having that therapeutic presence, I think, is something we can always choose to embody. But yeah, I just made that choice to do that in a different way. No longer in the family practice.
You've piqued my interest. What do you mean by having that connection with the patient? Is doing therapy unto itself?
Yeah, well, I don't want to speak for my colleague. I thought it was so wise what she said, but the way I interpret that is that everything that we do matters.
Right.
And even if you don't think that you quote unquote, convince someone to change their mind about whatever, maladaptive coping style or unhealthy habit they have, or if you don't think that what you said made a difference, simply that presence and being that human being with another human being and being open and curious and listening and offering some care and support, that, I don't know, maybe it's naive, but I have to always just believe that matters.
Yeah.
And to say that, like, me, just myself, am a therapeutic tool, rather than, I've got to have all this like fancy strategy, or it has to be, a 45-minute appointment, or, that sort of thing. And really being able to rest in that present moment of just saying, hey, this is just me and another person, and maybe they're sharing something about their life, I'm sharing something that might be helpful for them, and we're really working together towards that common goal of their well-being.
Right.
I think it's therapeutic for both of us.
I was just gonna say, I bet you there's reciprocity in that, where the person who you're helping might be helping you simultaneously in whatever regard.
Oh my gosh, I have had so many moments, like literally at least once a week, where I hear the words coming out of my mouth and I'm thinking, wow, that's really good advice. I should take that advice. Maybe I should be kind to myself more often, or, not be so harsh with myself, or, whatever I'm suggesting, go to bed earlier or something. So.
Self-compassion. Wouldn't it be awesome if we all had this self-compassion? I mean, you're sounding like you're a little younger than me, my generation. Just going back to what you're saying is, you're in university, you get the degrees, you get the accolades, and now you must stay there in that position for the next 30 years. And then whenever you retire, that's when you can try something new. So I appreciate the fact that you listened to what brought you joy, because my sense is always that what brings you joy ultimately brings others joy. And just hearing you and how that humanity, again, I'm making the assumption, and you can speak to this more, but that must be really difficult when someone is sharing their life and their story, and you're, oh darn, I have another patient in 5 minutes, or now I'm behind. Like, how does that make a busy physician feel?
Yeah, I mean, it's definitely very overwhelming, especially when someone then knocks at the door and says, oh, this, abnormal test result just came back, or so-and-so's on the phone that wants to talk to you, and you open up the EMR and there's 70 new messages that you have to answer. And it's hard when your attention's getting pulled in all different directions, which is where I think a lot of the mindfulness that I've learned has really come in handy, to be able to say, okay, how can I focus my attention on what I would choose to focus on, knowing that it's not just going to be laser focused. Like, even as we're talking about that interaction, that therapeutic moment with a patient, it's okay if I notice my watch buzz and it's my kid texting saying I forgot my shoes, or whatever else is happening, right? That I can notice where my attention has gone, and I can make that intentional choice to come back to the present moment. And sometimes it's just something as small as like shifting your posture, pushing your feet into the floor, taking a breath, and re-engaging. And we're human, right? We can't have attention that never wanders, but being able to have that skill of noticing, oh, okay, wait a second, I'm noticing there's like 50 different things my brain is trying to focus on. What would I like to focus on now? What's the most skillful? What would be the most helpful? Has really made a difference.
Can we go back at the time, probably during the pandemic, COVID, when you kind of made this decision to transition into more psychotherapy? Where did mindfulness come into this? Or were they just walking parallel to each other?
So I had a colleague in the psychotherapy practice that I was working in, this virtual clinic I was working in, who was already a few steps ahead of me, already facilitating mindfulness groups. And literally once I heard about this type of mindfulness intervention, I think it was just a moment, maybe almost like when I was 12 and I was like, I want to be a doctor. I was like, I need to do that. Right. So I heard about mindfulness-based stress reduction, or MBSR. My colleague also was facilitating mindfulness-based cognitive therapy, which is a program for people to prevent depressive relapse. And right away I thought, okay, I'd love to do this. And the group aspect really surprised me too, how much I enjoyed doing that. Because again, as a physician, sometimes you'd have family members together in the room, but we would never sort of teach a class or have a group setting. And I realized just how powerful having a group of people together in the room was. That again, it wasn't just about me, speaking about that therapeutic presence, right? It was a therapeutic nature of the entire group, that even though they weren't there to tell each other what to do or give each other advice, they were all sharing in that same experience of learning about mindfulness together, or talking about what might be helpful for them when they start to feel down again, or when their anxiety is rising. And it was really neat just to be in that group. It really felt energizing to me to be in this group of people. I've always been a group of people person, and I never thought I could do that at work. So I've enjoyed doing it at work.
So tell me what it was about mindfulness, because again, I don't want to judge, but I'm looking at the whole physician science, logically based, A plus B equals C.
Yeah.
And then there's this woo-woo stuff that, I say that, but I know there's lots of research behind it.
No, I know what you mean.
What was it that drew you to this woo-woo kind of stuff? Or were you already thinking, like, was your heart already in the process of there is something more to medicine than a 10-minute appointment and a prescription pad?
Yeah, that's such a good question. I think, like, first of all, thinking about mindfulness and what my, idea or assumption would have been about this, 10 years ago, I probably would have said, oh, okay, well, if you think that works for you, I guess it's okay. Someone said, oh, I do this mindfulness thing. I said, okay, good, but like, what about a medication? I think I would have been quite skeptical, partly because I hadn't been exposed to it very much, which hopefully is changing in medical education. But then once I started getting into just like the really evidence-based psychotherapy tools, so like cognitive behavioral therapy, I had always known from even way back 20 years ago when I went to med school that it was called the gold standard for treatment for so many mental health conditions. So it really had some credibility to me.
You mean cognitive behavioral therapy?
Cognitive behavioral therapy, yeah. So the idea of like, noticing the relationship between your thoughts and emotions and your behaviors. And so the idea of then, applying the skills of mindfulness to those same tools, I could really see, like, I think it was like a natural progression for me of seeing that, okay, if this makes sense and this is evidence-based, and like you said, there is so much evidence, so many trials on the mindfulness-based interventions as well, that it started to make more sense. Not only, though, I think just reading about it and learning about it, but also experiencing it for myself. I think that made me really realize, okay, this does really work. And that's actually part of the whole philosophy of learning to be a mindfulness facilitator, is that you have to take a course as a participant, not as an observer who's like just planning on being a teacher, who's just going to watch all these other people who have problems, but not me, but actually embody it for yourself, do the homework, think about it, experience it for yourself, and then you can learn to facilitate afterwards. I think it's a great model, because never in my medical training was it like, well, take this pill, see how it feels, and then you can prescribe it to your patients, right? Or have an MRI, and then you'll be allowed to order an MRI. And of course that wouldn't necessarily always be appropriate, but something about really experiencing it as a human being myself, and then sharing it with patients and with my colleagues, was just so different from anything else I had done. That was more, here I am, I'm the doctor, and here you are, so I'm using my hands, no one can see me. Down here you're the patient, and I know best. Right. Whereas, especially now, I think even in physical things, the patient knows their body, and maybe I know how to decode things, or how to, understand and, maybe wade through some of the murkiness when it comes to, what they might hear on social media is the best treatment or that sort of thing. But to come back to the fact that, like, we all know ourselves the best, and that it's not anybody else's job to fix us besides ourselves.
I love that you said that, honestly, that because, and I think as a healthcare practitioner, I was always taught I'm the expert. And the more that I get, I'm like, I'm not the expert of someone's body. They tell me they're in pain. I have no idea what they're feeling. I ask these, is it sharp? Is it dull? Is it achy? Is it throbbing? Those are hard words to put on something that someone is feeling, and the whole emotional component associated with it. That's one of the things that I've learned in forever. I am not the expert of anyone's body other than my own. So I appreciate you saying that. And I think because I am a patient, I sometimes expect my physician to be an expert of me, which I think puts a lot of pressure on physicians.
Yeah, it is a lot of pressure when you think about it, isn't it, right?
Yeah.
Or even the sense like, you must fix this.
Yeah.
And that's something that even in the medical students and the family medicine residents I've been teaching, right from the beginning, we've been saying, you know what, actually, I know this might sound crazy, but it's actually not your job as a physician to fix anybody. That doesn't mean you're not going to try. It doesn't mean you're not going to offer therapy and, do really good evidence-based, investigations and treatment and ask all the right questions and do a great physical exam. But in the end of the day, you have a piece of the pie, you have a part to play, but it's not all up to you. Because that's so heavy, right? I can even feel that in my chest just saying that. Yeah. Yes, it is totally my responsibility to make sure that X, Y, or Z happens with this person. Yeah. It's too much to put on one person, and it's not even real life, right? Because that individual has their own responsibilities, as they should, right? We don't want to be overly paternalistic by saying, hey, I'll handhold you all the way along. It's like, no, I believe in you. You can do this. Yeah. I'll give you the tools, and I'll give you the resources, and I'll be here for you if you need it. And as well, there's so many other factors that are happening, and sometimes that's awful, and it feels terrible when things don't go well for a patient. But to be able to say, yes, this didn't go well, and it wasn't because I did the wrong thing, or it was because I wasn't a good enough doctor. It's just sometimes bad things happen, or sometimes people get sick and you can't fix them. I think is huge, because otherwise you're just you're carrying this heavy weight all day long.
Of 1,000 people.
Yeah, and you just keep on adding more to it as the day goes by.
Yeah.
So no wonder so many doctors are getting burned out.
Yeah. I'm trying to organize my questions in my head, but I love the fact that you even said, I feel it inside, which I'm assuming is part of the mindfulness practice. Yeah. Can you, and I don't know if it's me, because this is my jam, I see so much stuff about mindfulness come through my social media feeds that when I say the word mindfulness, I'm like, do I actually know what it is?
Oh, sure.
Can you define what mindfulness is? And if you could speak to it in a way that, it's not using all these fancy kind of terms and words and stuff that I can take home and our listeners can take home. Okay, this is what mindfulness is.
Yeah, no, it's a good question. So I think that a lot of people have a different idea. Mindfulness is about a relaxation practice, or it's about feeling calm, or some sort of Zen state, whatever that means, right? But I always like using John Kabat-Zinn's definition, which is just simply that mindfulness is a way of paying attention to the present moment on purpose and without judgment. And then I think the first question people often have is, well, then what is the present moment, or what is your attention? And I remember reading, Amishi Jha has a really great book. She's a mindfulness researcher. The name of her book, of course, has escaped my mind. That's okay. I'll put it in the show notes. Yeah, okay, that sounds great. I actually saw her speak at a conference a few years ago, which is awesome. But anyway, so she says that your attention is like a flashlight. Yeah. So that's how I always explain it when I start off a group, that it's like if you're in a dark room and you turn on a flashlight, wherever that flashlight is shining is what you're able to see. Now, there are more things in that room, but because it's so dark, you're not experiencing them because the flashlight or your attention is on something else. And you can choose to move the flashlight wherever you like to pay attention to other things. And sometimes, just by nature of being human and having a human brain, your attention does get pulled over to something, right? So you hear a loud noise, or you hear something scurrying in the corner of this dark room, and you just, without even thinking, you just look at it. And the other thing that Amishi Jha also says is that your attention is your superpower. So this idea that being able to notice where your attention is and then place it somewhere intentionally is so huge, right? So even talking about that busy day, someone's knocking at the door, you've got 70 messages in your inbox, the patient's saying something that doesn't really fit the script, and you're not quite sure what's going on, and to be able to choose, what am I going to pay attention to? Am I going to pay attention to all of my thoughts in my head saying, I'll never figure this out, what a stupid doctor am I? Or, why does that person keep knocking on the door, leave me alone? But to choose how I want to go about paying attention. And also noticing that it's not like we're going to have laser focused, amazing attention all the time. There's no cure for being human. I think Katie Bowler said that. And so, of course, we're not going to fix our human brains, but noticing, okay, I'm trying to pay attention to this, or I'm endeavoring to, as best as I can. Maybe it's a breath practice, right? And then you notice your attention gets pulled away and you bring it back. And so I think, mindfulness really is best learned by experience, which is why I love doing these groups, because we practice mindfulness together, rather than it just being like a didactic lecture about, here's the definition of mindfulness, and this is what you should feel. But it's great to have that framework, which I love asking that question, like, what even is it? Just to understand kind of what we're getting into, and then to actually practice it and actually notice the experience of saying, oh, okay, I started thinking about my to-do list. That's okay. I'll just come back to my breath. And then you go back to your to-do list again, and you come back to your breath, and that sense of not judging and just noticing.
Jill, why is it important? Because in Buddhism, they call it the monkey mind, which I absolutely love. I'm not a Buddhist, but I love it because I see monkeys just going from tree to tree to tree to tree, which is my brain, right? I'll just spiral. I'll go from cleaning the house to doing laundry to having to think about emails to going to do my finances. And that's all within 5 minutes. So can you talk a little bit about why is being present or being mindful so important to my health, to my life, to my relationships? I know that's a big question.
Yeah. Well, I mean, we were saying before we started recording, I was just doing the session number 3 of my Mindfulness Skills for Busy Physicians group just before coming over here. And we were talking about noticing pleasant moments and how easy it is to overlook them. Again, especially if you're busy, especially if you're stressed. And as you said, a gazillion things can come up, and not one of them is like, oh, look at that nice sunset, or oh, look at the beautiful way the sun is shining off of the water, or whatever, right? Those things are all happening at any given moment, but we don't naturally pay attention to them. And a lot of that comes down to our evolutionary psychology of being so good at noticing the negative. It's meant to keep us physically safe, right? Our ancestors survived by being able to notice the rustling bushes and run for their life. Even if it was just a bunny rabbit, it wasn't a lion, right? But the ones who were noticing the sunrise and ignored the rustling in the bushes, they didn't get to continue their genetic material, right?
Why did I just see them eaten alive? Oh, that's so funny.
So I think that I love talking about that, and whether or not that's an oversimplification of evolutionary psychology, it probably is. But it sort of just opens us up to so much self-compassion, maybe to say, hey, of course I'm going to think about the negative things. Of course my attention is going to get pulled in all these different directions to all these things that seem so urgent or so important or so dangerous or threatening in some way. Yeah. And yet to recognize that I also have the power to turn my attention wherever it's most skillful for me. Right. And so again, today we're talking about, just noticing the sun on your face, or noticing, being with your family and seeing everyone enjoying interacting together and just observing and soaking it up. And I think, again, maybe sometimes, especially for busy professionals, whether you're a physician or otherwise, that feels kind of frivolous. It feels like, it's not really very fancy. It's kind of, like you said, woo-woo. Right. But this is, life passes us by if we don't notice these things.
I love you said that from an evolutionary perspective, because I think we think there's woolly mammoths out there to eat us, but the woolly mammoths are gone.
Yeah. But my inbox of emails feels like a woolly mammoth.
100%. Yeah. And that all of these things that are in my mind are so important right now that I can't take time to notice the sunset, even though the sun setting is only going to be there for the next 30 seconds or whatever. Yeah. We think this sounds really easy, that, just be present. It's so easy. However, I know it's not.
No, it's not. You're right.
Jill, can you talk a little bit about kind of your roadmap through becoming more mindful? And again, I'm saying that because I'm smiling here, but I told the story before about I tried to meditate for 5 minutes. I was part of this challenge. I set the clock and I think it was a minute I had lasted. And I thought, I'm an absolute failure at this because I can't clear my mind for a minute. I'm obviously no good at this, thinking I'm the only person. Recognizing now that was the point of what I was doing. But I think a lot of people out there say, I don't meditate, I don't be mindful, I'm not present, it's too hard to do and I can't do it.
Right. Or it doesn't work for me.
Or it doesn't work for me.
Yeah. No, I think you're right. That's so common. I think probably some of those misconceptions, like I've had the same, I should just feel calm, I should feel relaxed. Something special should happen. Whereas, the first time I did a mindfulness class was actually because it was during the pandemic. And again, as I was saying before, to become a facilitator, I took the course. So my colleague at the psychotherapy clinic, I joined one of his classes as a participant. And we were on virtual. And I still remember having my cell phone out of view of the camera. And, we're doing this breath practice. And I'm like, how long is this going to last for? Will anyone notice if I just start looking through Instagram or my emails? Or it was restlessness that came up for me. And I think I never used to let myself get restless because I never used to pause, right? It would always just be on to the next thing, on to the next thing. Again, 10-minute appointments, getting things done. Then there's the kids. There's never a moment that you're just sitting there just breathing, like, give me a break.
Right.
And I was surprised by that too, because I think I thought, okay, this is great. It's evidence-based intervention. It's so good for mental health. And then I felt so uncomfortable. And so now I really normalize that with my group participants, to say, it's a welcome side effect if you happen to feel relaxed during mindfulness practice, but it's actually not our aim. Especially when we're really trying hard to relax, it's almost like a paradox. It's like when I give people sleep advice too, right? The harder you lie there and think, I just wish I would sleep, I wish I would fall asleep, sleep continues to elude you. And same with relaxation, right? I just have to relax, and then you actually get really frustrated and upset with yourself that you're not good at relaxing. Right. So I was surprised by that, just how restless I felt, because it didn't seem intuitive or natural to just breathe or to just pay attention to one thing.
Well, and because you've been through like a heavy academic rigor of med school where and the pressure to perform, I assume, again, pulling those like all-nighters, and then the pressure, and then the 1,000 patients, and then the knocking on your door, and then the kids, and then the family,
No, I mean, when is there a moment to relax anyway, right? It wasn't like it was handed to me on a silver platter. I still remember one of my supervisors, I think this was in obstetrics in first year residency, sort of disparaging the fact that we had a union and that we had all these rules about how many hours you could work in a row. Like, you could only work 36 hours in a row before you got a chance to have a night off.
Only 36 hours.
And you could only be on call every fourth night in hospital, all these things. I'm not sure if the rules have changed now for residents. And she said, you know what? When I was in residency, we used to say, if you're only on call every other night, you missed half the good cases. So this mentality of just like every second has to be given to your career. Otherwise, you're just wasting your time. And you think, well, like, sleep is not a waste of time. Because we are also human beings who need sleep. And probably most of us would hope that our family member would have a physician who had had a good night's sleep before they're operating on them or delivering their baby or talking about their, confusing symptoms. But somehow it didn't apply to us, right?
Right.
If you sleep, you're weak.
Right.
Which is bonkers.
And I assume that applies to a lot of different professions as well, but, particularly physicians, because you are perceived as super people. Like, honestly, from the public's perception is you are super people, which is a tremendous amount of pressure that the public puts on physicians. Yeah. I know one of the things that you're interested in, and I'm super interested to know about burnout. And, because my sense is there's a lot of burnout amongst physicians, particularly after the pandemic. And just talking to you now with everything that you have to do in those 10-minute appointments, how can you talk a little bit about physician burnout and maybe how mindfulness can help busy people? Like, obviously physicians, but lawyers, stay-at-home moms, bank, like everybody's busy, right? So... Yeah, I mean, the first thing I would say is that a lot of system changes also need to happen. And I worry that sometimes these wellness interventions or whatever you call it in workplaces or in, educational institutions, it's like, what do you mean you're so stressed? We gave you that, little time off last week, or we did that seminar about burnout, you should be fine. And we can say, okay, wait a second. Yes, mindfulness and self-care and sleep and all these things are great. And also the system sort of sets us up to fail too. So kind of holding both those things at the same time. But I think to be physicians or professionals of any kind, people of any kind, to make a difference in the system, if you're really burned out, it's going to be even harder to create changes in the system or to have a creative idea even about what that change might be. So being able to support ourselves with our well-being with mindfulness, I think can really, open us up to being able to be part of the change if we choose to. But having said that, the system is a big part of the problem, right? And that's not in anyone's control, not any individual practitioner anyway. Otherwise, I think mindfulness, again, is about that sense of choice, that I could choose where I place my attention. I can choose how I talk to myself. I can choose what I do with this uncomfortable emotion or this difficult moment. And one analogy I often use is like the weather. Right, so if you look outside, like I was looking outside today saying, oh my gosh, it's snowing. It should not be snowing. You know what? The more I hated the snow, it did not vanish. It did not change. And we know that to be true about the weather, right? I'm not going to sit there and yell out the window for hours telling the weather to change,
because I just know that that's part of acceptance, right? That, okay, this is the weather today. But then we get into, well, what tools can I use to take care of myself? Well, maybe I'll wear my mittens and a hat and my warmer coat. And maybe I'll be careful and put down some salt on my driveway if it's icy, right? And what are those self-care tools we can use for emotional storms or, turmoil that happens in our lives? Is if we really focus more on how can I support myself and what can I do to get through this, rather than why am I so weak, or why am I having such a hard time, or why is this happening to me? I think that really can allow us to weather that storm. And again, I love the analogy too, because even though I wish the snow were gone now, I know it will be sometime, right? And just like the weather doesn't stay the same forever, our inner experiences and even our life experiences don't stay the same forever. So being able to support ourselves through it rather than resisting against it or beating ourselves up that we should be better at it, for me anyway, has made a huge difference.
Do you think that's something that a lot of people do? Because I know that certainly resonates with me, that inner voice, that you're not good enough in name it, right? Like parenting, friendships, physical, like you're not good enough in a million things. And that's one of the things that I can honestly say mindfulness has really shifted for me, is I recognize that I give myself grace. I'm not perfect. I don't have the answers to everything, and that's okay. Which is weird. And I assume I'm not the only one who has experienced that, question mark?
No, I don't think so. I think you're right, because noticing thoughts as sensations is a real aha moment for a lot of people as well, getting into mindfulness, and definitely was for me, because you start noticing your breath as a sensation, and we do a body scan, so we notice different areas of our bodies and notice those sensations, and then we say, oh, now turning attention to your thoughts. So like you said, when you notice in your mind, I'm not good enough, we can say, oh, like that's a sensation. That's, brains make thoughts, just like, my feet feel warm, or my heart is pumping blood, my lungs are breathing, my brain makes thoughts. And again, my brain's really good at seeing the negative, at being really strongly worded about what might be negative in order to keep me safe. But when I notice, oh, okay, here goes my brain saying that same old thing it said a lot of times, you're not good enough, it kind of loses its power. And then we can get a bit more specific and say, okay, like what's really going on here? Like what's really needed? Do I need to kind of let myself off the hook? Is there actually a skill that I am lacking that, again, I'm human, I can't have every skill, that I need to ask someone for help with or learn more about? Because just telling myself I'm not good enough, it doesn't really help. It doesn't really fix anything. But I think our brains are trying. Like our brains are really trying to say, I'm here to help you.
Right.
But we often say in psychotherapy that your brain is like an overly helpful friend. Whenever I worked with patients too, we always had like, who is a person in your life who, gives well-meaning but not very good advice?
Yeah.
Right? And how can you, even sarcastically or kind of in a silly way, if that resonates, sort of say, thank you, brain.
Yeah.
You know what? You told me that 5 times yesterday too, that I'm not good enough. I know.
Yeah.
But you know what? When you keep saying it and you don't give me any, more feedback about how I could improve or what exactly is the problem, it just makes me feel terrible. It doesn't really help. And noticing that, okay, this is just something that brains do.
That is so
helpful.
Awesome. I mean, really. I'm laughing because it is so true, right? Like I've been telling myself X for how many years and nothing has changed, right? I'm still no different than I was yesterday. But I want to talk a little bit about the internal sensations. And again, the podcast isn't about me, but what I've learned is I'm one of probably a million other people. But I took part in this kind of meditation whereby, and my dog is very important to me. She's beautiful. And I just sensed how I was feeling when I thought of her. So I brought her to my mind's eye and I recognized my sensations internally. And then I pictured somebody whom I wasn't comfortable with, whether I had an argument with them, and I noticed how I felt internally. And it was amazing to me how my chest tightened, how my stomach became upset. And then, the facilitator's like, go back to thinking about that good thing. So then I went back to thinking about Sasha and it disappeared, which really I found was amazing in how I can control my thoughts, which was kind of the take-home message. And there is a question. Is that something that you often work with some of your addictions people or your clients, is becoming in tuned to your internal sensations?
Yeah, definitely. I mean, every morning at Homewood, we do a group rounds, and there's always kind of like an interesting question to sort of get the day started. And the hardest question that I ask is, we first always say, what emotion are you feeling this morning for the patients as we go around the room, and again, just to get a sense of how they're doing, but also to get them to turn inward and check in with themselves. How am I feeling? But the hardest question is to follow up on that and say, and how do you notice that in your body? Because I don't think any of us learns this in school or in childhood. What do you mean, how do I feel in my body? And often the most common thing people will say is, oh, I feel it in my head. And I never correct them and say, no, you don't, because that is, they're describing their experience as best they can. And I think the exercise of just attempting to tune into your body is amazing as a practice, even if you don't really quite notice what it is. But often I wonder if when people say, oh, I feel it in my head, is they're noticing the thoughts. And it's so, I think, so it's such a coping skill for us to use to try to disconnect from the sensations in the body and to just stay in our heads. Because sometimes those sensations are really not nice, especially people who've been through trauma. Right. It's not safe. It doesn't feel comfortable, and rightly so. That's reasonable. It makes perfect sense. But you're right. There's so much to be learned from our bodies. Yeah. So much our bodies can tell us, especially about early signals. Yeah. I found that's been the most helpful for me, and that's one of the topics we always discuss in the mindfulness groups. Is what's an early signal for you in your body that you're getting stressed? Because most of us are pretty good at recognizing when we're at the end of our rope, right? When I'm so overwhelmed because I'm yelling at my kids and, I'm being short with my patients maybe, or it's pretty obvious, right? It wouldn't take a rocket scientist to tell that person was stressed out. Right. But if I can, rewind the tape and get back to when I was starting to feel a bit stressed, what did I notice my mind was saying? What do I notice in my body? And then what can I do just to slightly pivot or, give myself a bit more space at that moment to avoid getting all the way to the point of being overwhelmed, I think is such an amazing skill that a lot of us don't give ourselves permission to do, or we never learn to do.
Yeah, Jill, which brings up my next question. How do you learn to be mindful?
Just by practicing.
Yeah. Can you give us some, maybe if you're working with a client and you want them to learn to be mindful. I know we always look for what is the easiest way to do this, and this isn't an easy practice. But can you give us some starting guidelines, some tips on how can I be mindful today?
Yeah, I think picking just a routine activity that you always do anyway, and then just making that choice in advance that, okay, this week, for example, whenever I brush my teeth, I'm just going to notice my 5 senses. So I'll notice, the flavor of the toothpaste, or I'll notice the buzzing feeling of my electric toothbrush. Or I'll notice my feet on the ground, the posture I'm standing with, maybe the smell, or whatever else we're experiencing, and to simply be there and brushing your teeth. And then, of course, you're going to get back to your to-do list, and something else is going to come up, and you'll be distracted, or your phone, and then to recognize, okay, wait, my attention was pulled away. No big deal, perfectly normal. Now I'll just come back to brushing my teeth. And in the groups, we actually have people choose a new routine activity every week. So that way you kind of get to just practice a few different things. Some people will choose when they sit down and turn on their computer, they'll just notice what it's like for the computer to take a long time to load. Right. Or where they place their phone down is actually a great one, because then it's easier to find it again if you actually pay attention to that. Brushing your teeth, eating. Mindful eating is another great one as well, just to notice the flavor and the texture of your food. So I think those are really accessible moments for a lot of us, just to notice routine things. Walking is another great one. Just noticing your feet on the ground, or noticing, the breeze or the sounds of the birds if you're outside. And then recognizing that you don't have to feel relaxed or not get distracted, but it's just paying attention and being curious with what that direct experience is like, rather than how we often experience our lives, which is more like that inner narrator, right? Like, oh, it's too sunny, or it's too cold, or, I'm walking too fast or too slow, or, whatever kind of sense of judgment comes up. And of course, those thoughts will be there, but we can notice those as well as sensations. And I think it's just the practice, just like any other muscle. How do you learn how to ride a bike? By practicing, right? How do you learn how to do any other skill? We just need to practice. Yeah.
I love that you said that, because I'm going to assume we all brush our teeth. So it's something that I do every morning. I don't know, how long do I brush my teeth for? 30 seconds, whatever, 45 seconds, whatever. But it's not like I have to set aside 45 seconds that in my busy day I don't have. I'm doing it anyways.
Yeah.
Or if I'm taking my dog for a walk, I'm already going to take my dog for a walk.
Exactly.
That I can do it anyways. So it's not prohibitive from a time perspective, and I think we see meditators who dedicate 20 minutes to like chanting and and that type of thing, which is, I don't have 20 minutes in my day. So I appreciate what you're saying. Can you talk a little bit about why the practice is important? And by that I mean the repetition, not the practice unto itself.
Yeah, well, the first thing that comes to my mind as just more of an example of how I've noticed the practice is helpful for me is part of my training was I had to go to a silent retreat. So I went to this beautiful place, Sugar Ridge, up by Midland, for 5 days. Amazing food, by the way, amazing vegan meals. Speaking of mindful eating, right? Because we couldn't talk, so all you could do was eat during the meals. Right. So you really noticed your food. Yeah. But we would do an hour practice every morning of like 20 minutes of paying attention to your breath, 20 minutes of walking, and 20 minutes of breath with no guidance. She would just ring a bell at the 20-minute intervals. And I'm not saying that to sort of say, oh, I did this big, long, silent retreat. Right. But what I noticed was the more time I spent with my breath, the more it felt like a really familiar place to come back to. And especially in like the weeks after I went home from that silent retreat, it felt different to pay attention to my breath because I just practiced it so much. And I think that's really the magic, if there is magic to mindfulness, is the more that you practice noticing your breath, then, for example, I mean, there's lots of other things to be mindful of, but as the example, then when you sort of need that in a stressful moment, you're feeling overwhelmed, it's this safe, comfortable, familiar place to come back to, rather than being like, oh, how do I do this again? And what am I supposed to do? And okay, like, and I always think of this as like the analogy of like running a marathon. You wouldn't say, I'm going to run a marathon tomorrow and expect your body to just be able to do it without practicing, right? Well, we have to train and we gradually increase our mileage and all the rest, right? You need months and months to train. And similarly, I think to be mindful, giving your body that opportunity to get used to it and to be able to come back to it, and sort of like the rewiring that happens, I think, in our brains when we just intentionally pay attention more often. And I know for me that made a big difference to have that extended time. But as you said, it can also be a big stumbling block to say, well, if the only way to be mindful is to carve out 5 days for a silent retreat, well, I don't have the money for that, or I don't have the resources for that, or I don't have anyone to leave my kids with, so I can't do it at all. And that's another common way that our human brains think of that all or nothing, which is really why I decided to adapt the mindfulness interventions to be shorter sessions and shorter practices, because I really believe that like something is better than nothing. And if you would have asked me, the like stressed out, a little bit skeptical of mindfulness, busy doctor 10 years ago, oh, I have a great idea for you. How about come to this class that's 2.5 hours every week and has an hour of mindfulness homework? I would have said, that's ridiculous. I'm not doing that. I'm too stressed out. That'll just stress me out more. But recognizing, what is possible for me, and then it can still be beneficial, right? Like you said, just brushing your teeth mindfully for a minute. That's definitely something. And we don't have to minimize the benefits of that or say, oh, but so-and-so is better than me, or they're doing a more prestigious kind of version.
Well, what I love about this, and this suddenly occurred to me, it really doesn't have a barrier. And by that I mean privilege, gender, race, belief, job. Like it really, and it's free.
Yeah, you don't need any special equipment.
Yeah, and nobody even knows I'm doing it. I'm going for a walk, and other than the fact that I may not pay attention when someone says hello or whatever, it is zero cost. Which I'm going to guess, and please fill in, are there any non-beneficial things? Are there any harms? Is there any issues? When you get a prescription and it's like, and
side effects.
Thank you. I was looking for the word.
Yeah. No, I think definitely. I think that I would never want to oversell and say, oh, mindfulness works all the time for everyone and there's never any problems, because probably if anyone ever says that to you about anything, they're missing something. And definitely we know from the research, especially with patients or people with a trauma history, if their body doesn't feel like a safe place, if they have a lot of very intense, very aversive emotions that they, for reasons of just self-preservation have really disconnected from, if you say, well, now pay attention to your body, or now pay attention to something that brings up that trauma for them, it can be really overwhelming. And I think the most dangerous part of that is if you have a facilitator who doesn't understand how to walk someone through that and can inadvertently add to the problem by saying, well, you really should be feeling relaxed right now, or like nobody else in my group has ever had that experience. But to always believe people and to validate them. And I always give people the option to change what they're doing, even if they don't have a trauma history. Again, like I said, I was even just very restless in my first practice. And then we talk about being within what we call the window of tolerance. Mm-hmm. And so if you're able to be present with whatever is coming up, if it feels spacious and available to you, but if it feels like you're forcing or it feels like you're pushing through, then what I always say to my group members is, we're already too good at that, right? We've practiced that enough. The pushing through, the ignoring how you feel, the forcing yourself to do what everyone else is doing to fit in. This is a perfect moment to just do what you need. So if that is just not doing the practice for a few minutes and taking a drink of water, standing up and stretching. We sometimes do some mindful movement, whether that's modifying the practice, even if everyone else is putting their arms above their head, but your shoulder hurts today, to honor your body and to honor your limits is such an amazing thing that I would way rather people do in the group than, just follow along and just do what they're told. Right. So I think, that can definitely be a problem with mindfulness if it's not maybe explained properly or not done within the right container of safety, that people can really be quite overwhelmed by what they notice, especially if there's a lot of, just pain that's stored in their body that they haven't had a chance to process yet or haven't had the opportunity to be supported through.
Right. Jill, can I tap into what do you do for a mindfulness practice? Like, do you sit for 20 minutes? I mean, you've alluded to it somewhat, but do you have a dedicated mindfulness practice? I do not. I say I catch it on the fly, right? Like, maybe today I'm just going to spend some time breathing because it's where I am. If I go for a run, I focus. So can you share a little bit about your practice?
Yeah, well, a little bit of self-judgment is coming up as you're saying that, because I would love to say, every morning I get up and I do this 20-minute thing. Honestly, I think that exercise is my mindfulness, that has always been a way. And I think even before I could name that, I've loved, being active for a long time, like before I discovered mindfulness or a lot of this mental health stuff. But I think it was, for me, an easy way to just get into my body and out of my head, because you're noticing how it feels, you're breathing harder, your muscles are working, and I always enjoyed that feeling. I know not everyone loves that feeling of being sweaty or exercising, but that, to me, was just a very easy way to kind of get out of my head and into my body. So that's something I do routinely. And then, I have to say, it's a privilege to be able to teach these mindfulness classes, because a big part of the philosophy of being a facilitator is that you're practicing with the participants. So I'm not just, reading off a script or, telling them what to do. I'm practicing out loud. Right. So I always get that chance to do it. I don't always do the same homework that I assign. Right. Which I should.
But that's giving yourself grace,
like right? Yeah.
That's recognizing where you are in the space that you're at and honoring that.
Yeah. But otherwise, I think the main thing I do is just like, I'm noticing my breath for a few minutes. Yeah. Or even just giving myself a few minutes of physical space from other things. Yeah. And making that be okay. That doesn't mean that I'm weak. It doesn't mean that I'm a failure. It just means that I'm a human being with a finite amount of energy, and it's starting to run low. And just like, the gas tank on your car gets low and you go to the gas station, I just need a refill. I just need a little bit of a pause. So that I think helps me a lot. But it's a lot more informal than formal.
Do you find that since your practice has started, and if you're okay to share this, what changes have taken place in your own life? Like, I'm asking the question, but feel free to be, very editorial in what you're saying.
I think I've gotten a lot better at saying no. So I think it used to be, for example, if someone said, can you be on this committee, or can you help me out with this? I wouldn't even notice that I had a moment to choose. It would just be like, yes, just comes out of your mouth before you even really think about it. And I think for me, there was a lot of short-term benefit to that. It feels really good for someone to say, thank you so much. Like, you'll be so great at this, or I really appreciate it. Like in the moment, it's like seeing a brownie on the counter at work and just eating it because it tastes so good and you just want it, right? It's like it's such a great short-term feeling. But then, future me is what I would say, who then is on this committee and signed up for this extra thing, and they're all happening on the same day. It's like, what the heck am I doing? Yeah. This is too much. And then I say, but it shouldn't be too much. I should be stronger than this. I should be able to handle these things. And so I think just really allowing myself to have a capacity and actually working a little bit below it to give a little bit of space. Not to say, if I have a little bit more energy, sure, I can do more. But maybe if I have a little bit more energy, that's actually a sign to not do more, because I'm actually, at a pretty good balance right now. Right. So feeling less guilty about saying no to things, and really, I think checking in with myself. about what I say no to. If it isn't something that I would really love to do, I think I heard this from another physician a while ago, give someone else the opportunity to step into that role. I think we often think that if I don't do it, no one will,
right.
and they need me. And I think that sometimes just leads to more burnout. So maybe that might sometimes be true, but in a lot of my experiences, if you say no, there actually is somebody else who steps up. And maybe they really wanted to do it, but they were just a bit nervous. And, who knows, right? But allowing someone else to take something that they love and stepping back from something that I don't love. And then similarly, when there's something that actually sounds pretty amazing, but it terrifies me, saying yes to those things has really been helpful. Because I think I've noticed that I probably used to say yes to a lot of things that I felt obliged to do, and no to things that felt exciting but kind of scary. And whereas I'm trying to flip that around and do more of the exciting and scary things and less of the obligatory things.
I'm going to ask you a somewhat personal question, so feel free not to answer this, because I know my husband says there's something different about you, and he'll even tell you our marriage has gotten better. And he's like, I don't know if it's me, but I think it's you. And I'm like, I can see kind of where that, in your personal relationships, like I know you have 4 boys. Do you notice that they notice a change? Is there a spin-off where they're starting to take part in their practice? Your friend relationships, your marital relationship, I was almost going to put an S on that. Do you notice any changes with your relationships?
Yeah, that's a really great question. I should poll everybody when I get home and say, Jackie asked me this question. What do you think? I think I definitely have noticed that I appreciate moments with my kids more, especially like my oldest is now away at university. And so it's especially poignant when he is home or when he's around or when we're talking on the phone or, video chatting or whatever, to just really like be present and just enjoy that. And to just really feel so happy with all the things that he's doing and accomplishing. Or even, I think I used to kind of beat myself up, and again, that not enough, right? There was always some additional amount of time or additional amount of something that good moms did that I wasn't doing.
Right.
And when you're focusing on that, then you're not really able to be present and enjoy what you are doing. So I think that's made a big difference, to just really enjoy, even if I don't have as much time with my kids because I was working longer, or even if I'm kind of tired and so we're not doing some big fancy activity, we're just hanging out together, right? I allow myself to kind of do what I feel like I can do and allow that to be enough. And I think I expect less of other people too. And I don't mean that in like a bad way, like, oh, I just know people, are going to disappoint me, so I just don't get disappointed. Like, I don't mean it in kind of like a defeatist way, but just to really enjoy allowing people to be themselves and not trying to put them into a mold of someone that they aren't.
Right.
Because I think I've spent a lot of time in my life wishing people would be different, or wishing people would, meet my needs in a way that I think that they should. And I think a lot of that is okay, right? Because we all do have needs that need to be met. But to be able to step back and say, what if it was okay for them to just be themselves? And I can play some of that role for myself, or I can seek that elsewhere. I think it allows me to, maybe not have that same sort of pull on some relationships that I might have before.
Yeah, thanks so much for sharing. Because I believe, only from my practice and from what I've seen, is when you're grounded and when you're centered and when you're in a better place, people can't help. It's almost that energy. And I know I'm getting into the woo-woo stuff again.
No, I love it.
But people sense it. And then you become a calming presence for others. And then it's almost like, these are just my own experiences, but I notice a complete difference amongst me and others that have started this practice as well. Jill, one of the things that I'm really excited about is your TMU affiliation and the fact that you're teaching students, because I know as a professor, I see our students struggle a lot, and I cry literally when I think of them. And I think you're giving your students, I hope, a gift. Can you tell me about kind of what role you see yourself as a mindfulness facilitator with your students?
Yeah, I mean, I have definitely really enjoyed it. And it was interesting, I even just had a conversation with another faculty member the other day who was even a few years ahead of me in their training. And they were saying, like, it's such a gift to be able to treat medical students in a way that we wish we would have been treated. Right. And to create a new culture rather than, oh, you can't understand this, well, you're just, again, not good enough, right? Or, that's your fault, but, oh, how can we support you? How can we, work on this with you? How can we, make things easier for you? And so I do hope that the students I work with a few students directly. I have a group of 10 amazing women in my case-based learning class. It's like a small group class for the Principles of Medicine course. So that's kind of like the meat and potatoes of medical school. And it's been amazing just to like learn from them, and actually kind of fun to go back to like first principles and, basic science stuff. To say, oh yeah, I forgot about that, cardiac action potential, or, these, molecules that do these things that, in clinical practice, you don't think about, but is kind of a fun part of, human physiology. And I hope that, as we talk about cases, I've been able to sort of share with them a lot of what we've talked about today, even that, allowing yourself to be human, allowing yourself to bring your personality and, your humanness into that room, again, to be that therapeutic presence, really can help you to continue to enjoy your job rather than really just focusing on, because there is, especially as a learner, there's so many new facts to focus on. There's so many like red flag symptoms to ask about, and what if I miss something on the physical exam? And it can be so easy to get caught up in your head, caught up with all the science, and then forget that you're just a human being, supporting another human being, because you also do have to know all the science and stuff too, right? So it's a lot of a juggling act, but it is really a privilege to be able to be with these first year medical students, and then also first year family medicine residents. I do a lot of more like didactic workshops with them in psychotherapy skills, just to share some of what I've learned, and hopefully allow them to kind of bypass a few years of my experiential learning and get some of the wisdom from my experience. Yeah, it's really fun.
I absolutely love what you're saying, and my sense is to not take the weight of, and I only say 1,000 because I assume that's kind of how big a practice is, 1,000 patients, to not feel responsible for 1,000 people to fix them. Yeah. What a huge gift you're giving them, so that they don't have to travel through the same path that you have.
Yeah. We did a sort of a seminar with the residents a few weeks ago, talking about like what is my job really. And I said that if you would have asked me that a few years ago, I would have said to fix people, to make sure that I sort out the diagnosis every time, to make sure everyone walks out with a smile on their face, happy with the treatment I'm offering, right? And to recognize that actually that's not really my job. I can't force someone to be happy with my advice, especially if they had a differing view on what they thought was the best treatment plan, and I, didn't want to offer something that could be harmful, right? There's so many examples of times when things don't go according to either of our plans, the patient or the physician. And so to say, well, if my job is simply to, be present with people and, offer what I can, support them, advocate for them, but recognizing that it's not in my power to fix everything, it's a whole different attitude, a whole different experience of going through your day, rather than like, I must figure this out, I must do, like, have this high bar that is unachievable, really.
Right. Jill, one of the things I'm really excited about, and you and I were chatting about this before we started recording, was about your new initiative, which is starting a new, it sounds like a new paradigm of medicine and what you're proposing. So. Can you share a little bit about what the future of Dr. Jill Bailey and Associate looks like?
Yeah, thanks. It is. It's really exciting. So I have a good friend and colleague who we worked together a lot when we were both in the family practice. And we both have left that practice over the last few years, but just remained friends. And she approached me last summer and said, I really want to start like a multidisciplinary women's health clinic. And actually I should back up and say I was debating what I wanted to do next in my career, because I was really realizing I didn't want to work as often virtually as I was. Right. Sitting at the computer just wasn't doing it for me anymore. So I was talking to a very wise friend from university, going over a few options I had, a couple different things I was looking into. So again, this is like a week before I met with Kylene, my business partner. And Abby, my wise friend, said, I just get this sense that the thing that you're meant to do hasn't come up yet. And so then Kylene and I go out for coffee, and she mentions this clinic idea. And funnily enough, she also knows Abby because they were colleagues in university, small world. And I said, you know what? Abby said to me last week that the thing that I'm supposed to do hasn't come up yet. And we both sort of had this moment like, whoa, that's kind of cool. And so it has been a journey of working together on sorting out, both of us being new to starting a business and both of us having lots of other things. We both have 4 boys, so between us we have 8 children and other jobs. But now things are really starting to come together to get this women's health clinic started. We've incorporated, so our name is Stillwater Women's Health.
Wow.
And we just have this vision of being a place where women can come, and I say women as in the people who work with us as well as the clients or patients that come through the door, and just feel that sense of community. Like a lot of the things that we've been talking about today, that sense of being heard and validated, of having people around you who care about you, and the healing power of just having a human being who's listening, as well as, of course, sort of demystifying a lot of the misinformation or unhelpful information that people might find about any type of women's health care, but especially menopause these days. So I'm writing an exam. First time I've written an exam in a long time. It's the menopause certification exam through the Menopause Society in a couple of months. So I'm busy studying for that too. And it's been really a fun time. I know I love learning, so there's always something new to learn, which is fun.
Yeah.
And we're really excited to be working with women in the community in this way.
Wow, Jill, I am so excited because as a woman of menopause age, I have an amazing physician, by the way. But I talk to some of my friends and I'm like, what are you, like, there's so much misinformation out there and I know nothing. But I know that taking, grapeseed oil is not going to cure your hot flashes, right? Like, and it's, it feels very political, but I love the fact that, again, you're looking at this from a multidisciplinary, evidence-informed approach, using so many different things that you will put together. Like, well done for you. Yeah. I'm excited that Orangeville has this, and I'm sorry for other communities as well. So I'm putting you on the spot here a little bit. When do you think that the doors may open? I know you are just really into the early stages.
Yeah, I mean, it's looking like it could be sometime this summer.
Okay, summer 2026.
2026, yes. Yeah, so stay tuned. Hopefully we'll have more information soon. It feels like a lot of moving parts, but I always try to remind myself everything is figure-outable.
Right.
I don't think I made up that word. I think it was a book I read that was called that title, Everything is Figure-Outable.
It's like truthiness, yeah.
Yeah, and even though I've never done this before, it doesn't mean it's impossible. Yeah. And using my resources, my husband is an accountant, which is an amazing resource. Kylene's husband is in insurance, so we've got those areas covered. And it's just the journey of, meeting other women. That's been actually a really pleasant side benefit of just I've reached out to a few women that I've maybe lost contact with, or people that I sort of knew peripherally through a friend of a friend or something. And everyone that I've connected with has just been so supportive and positive, willing to just chat about like their experience in business and what went well and what didn't go well. And I just think it's such a beautiful testament to like the way that women always just rally around each other and support each other. And we can like enjoy the fact that someone else is doing something positive, rather than like maybe being competitive or negative. And so that's been really amazing too, just to feel, even before we've even opened our doors, even before we have a door to open, just feeling such a sense of encouragement from other women in the community.
And I'm sensing being mindful just allows you to pause and reflect and not get overwhelmed.
Yes.
Even though that's
so true.
It's there.
Yes, yeah, because I definitely couldn't. I've seen that. Speaking of noticing the early signals, I've seen, I can see I could just start spiraling into, well, I don't know how to do that. And how do we incorporate? And then, well, what do you mean you have to do, this thing? How big does the bathroom have to be to be up to code? And I don't know how that's going to work. And you could easily just say, well, then I'll just not do it then.
Right.
It's just too difficult. Right. And that's maybe getting back to this idea of saying yes to things that are scary but exciting. And it's like, okay, yeah. But just because I don't know what size a bathroom has to be up to code doesn't mean nobody does. Right. And I can ask someone for their advice. I can get an expert to come and help me, right? And actually, even as I'm saying that now, I have to talk to my patients about how like the obstacle is the way. And that's an old Greek saying, that noticing that there might be things that you don't know, or noticing there might be things that are in your path. Now you've got your plan. If all I have to do is figure out how to do these things, and now I know how to figure it out. Right. So that's a helpful flip.
I love that. And I know you will be very successful in this.
Thank you.
And I know that, my fear for you is be careful what you open the doors for, because my sense is there's going to be a lot of people that are looking for something, women, to be heard, to feel empowered, to not think that not that every practitioner thinks that, but you're not crazy. Your symptoms are real. Your feelings are real. Your pain is real. Whatever.
Right.
To be believed is I think a gift that you will give so many. Jill, one of the questions I always like to end with is looking back to when you were 12 years old. What advice would you have given that 12-year-old, knowing where you are and the path that you've taken?
Yeah, that's such a great question. I think I would just tell her, there's no rush. It's okay to take your time. It's okay to fail or not figure things out on your first try. And yeah, you can go through the journey is a journey for a reason, kind of thing, right? It's okay to learn along the way and to not get it right on your first try.
I love that. I think that's important advice for everybody. Especially for driven, intelligent girls.
Yeah.
You don't have to be everything. That you will fail first attempt in learning, and that's something to learn from. It's not something to be ashamed of. So
yeah, totally.
Yeah, Jill, thank you so much for this conversation. I truly appreciate it. I have learned so much, and I could keep talking to you forever about this very important topic of mindfulness.
Yeah.
So thank you so much.
Oh, thank you, Jackie. It was so great to be able to chat. I could talk forever too.
Many thanks to Jill for sharing her story and reminding us that healing is not always loud. Sometimes it is quiet presence in a room, a pause before speaking, a willingness to stay when things feel uncertain. Dr. Bailey's work reminds us that medicine, at its best, is deeply human. It asks us to see beyond the diagnosis, beyond the role, beyond the outcome. It asks us to remain open. Whether she is sitting with a patient, mentoring a future physician, raising her boys, being with her husband, or imagining a new kind of space for women's health, her work begins in the same place: attention, compassion, and presence. The inner practice is not separate from the life we build. It is the ground beneath it. If this episode resonated with you, please like, share, or follow the podcast. Your support helps these stories reach the people who may need them most. And if you would like to support the podcast, feel free to buy me a coffee. The link is in the bio. And if you feel called to share your own story on the inner practice, please send me an email with a short bio. I would love to hear from you. Or simply leave a comment. I read all comments and share them with the guests. Thank you for listening to The Inner Practice. Until next time, breathe, pause, and spend time being present.